Well, we just appreciate it. We appreciate everyone taking time out of their busy schedules to join us today to learn more about the Kansas City Physical Activity Plan. When Robin approached me about it, I just was really excited about it, and definitely was something that has interest to me as someone who's definitely into physical activity and different sports. Just was really something that I wanted to be involved with. And I'm glad to see that we have a good group as well that is really interested to hear more about the plan, and just welcome everyone, and just thank you again for joining us.
Right, and I'll have to echo that. I am so excited to be a part of this and a part of the co-sector lead with Melinda. Thanks for Robin for having us and inviting us, guys, and thank you for showing up. I know you guys have a lot of questions and you want to get to the meat and bones of this, but me being a physical act, I guess being involved in physical activity myself, I run up and down a basketball court every weekend. Guys, you know, I bike ride. So I just thought it was a natural thing for me to get involved in this as well and just kind of help use my platform to promote physical activity in Kansas City. And I hope you guys think the same thing.
Great. Thank you, both of you, for those words. So I'll talk a little bit more about this as we move throughout today's presentation. But as we mentioned, weighing in from Children's Mercy is considered the backbone organization for the Kansas City Physical Activity Plan. So Bryce and I spend our time managing all of the logistics around the plan, so scheduling meetings, setting up the technology like you're going to see today, taking meeting minutes. We'll send out a summary of this meeting at the end. But we're not experts in these different areas, and that's where we're relying on Melinda and Toriano to provide content expertise and networking to get everyone to this meeting. And then as we over the next, they're going to be really leading and facilitating discussion with y'all, and Bryce and I will just kind of sit in the background a little bit more. Now, I know that you probably have a lot of questions about what exactly is the Kansas City Physical Activity Plan, what is the mass media sector, and how does this fit in to trying to change the culture of active living in our region. And so I don't want to make this like a formal didactic presentation, but I do have a handful of slides that I'm going to go over that hopefully answer some of those questions, but you are welcome to ask questions as we move along through today's presentation. So let me share my screen. And there we go. So here's all the information that we just went over, who our co-leads are, their contact information. All of these slides that I'm sharing with you today and everything that we'll do over the next several months, we will distribute to you afterwards in the form of like a running newsletter, in addition to sending out a recording of this meeting. So here's all of our names and contact information. And here's today's meeting agenda. So as Bryce mentioned, we're recording this meeting. Hopefully that's okay. One thing that would help us today is if you could all put your name, your organization that you work for, the organization that you're representing at this meeting, and your role within that organization in the chat. It's kind of our way of creating or of taking attendance of all the people who are here for today's meeting. So I'm going to go over the Kansas City Physical Activity Plan. That'll take about 10 or 15 minutes or so. We'll discuss the timeline. I've mentioned before that this is a several month-long process. So I'll explain what's going to happen over those next few months. We're going to review what has already been done on a national level through what's called the National Physical Activity Plan. And we're also going to talk about some specific needs for our region and who might be missing from the table that's not here today. So we've done our first Mentimeter questions. We've done our opening remarks. And so now I'll just kind of lead off onto why I think mass media is perhaps the most important sector that influences someone's physical activity. And I say that as a physical activity researcher. I am a researcher at Children's Mercy. That's my primary responsibility. I study why kids are obese, and that most often has to deal with measuring physical activity and measuring healthy eating in kids. And through my experiences, I've learned that perhaps the number one most effective physical activity intervention that has ever been done was not done through YMCAs, was not done through personal trainers. Instead, it was something called the Project Verb campaign. And you may remember Project Verb. Does anybody remember seeing those commercials on Nickelodeon, Cartoon Network, or just regular television, or hearing about it in your kids' school or your kids' PE class? Anybody? Whoops.
You're too busy outside playing.
Oh, that's good. Well, Project Verb started in 2002, and it was run by the Centers for Disease Control and Prevention. And it was targeted at children between the ages of 9 and 13. And the goal is to get them to be active every day. Verb used, and I'm just reading verbatim here, as a social marketing approach to deliver a positive physical activity message through mass media, school, and community promotions, the internet, and partnerships with national organizations. There was some theory behind it that you can see here, but the goal was aimed at inspiring children to be active, emphasizing free time play in their backyards and their neighborhood parks. This was the largest physical activity intervention that has ever been run in the history of the United States. It cost $339 million. As a comparison, a large physical activity trial right now would be considered around $2 million. So this was $339 million, and it was designed to use sophisticated techniques of commercial marketers, building the Verb brand, conducting extensive formative research, using professional actors, buying media and promotional opportunities to reach a substantial portion of the target audience. It primarily went from 2004 to 2006, again, targeting children between the ages of 9 and 13. In that period, over 75% of the 21 million US children between the ages of 9 and 13 were aware of this campaign, so it had pretty good saturation. Kids knew about it. If you were a kid between these ages in the early 2000s, you still remember those commercials. And it was effective. As exposure to the Verb campaign increased, meaning how aware you were of it, how often you saw it on TV or in your school, your physical activity participation increased. So kids who didn't see the campaign were doing about 2 sessions of physical activity in a day, whereas those who saw it were doing almost 5 sessions per day. That is a huge, huge impact. And as your exposure to the intervention increased, your outcome expectations, meaning what you knew about physical activity, whether you felt you could do physical activity, was positive related. So this, as I mentioned, is probably the most successful physical activity intervention ever. And it was not through YMCAs or through personal trainers, it was a mass media campaign. Here's another media campaign I wanted to share. And this is just down the road. So this catchy little tune is from just down I-70 in Columbia, Missouri. Columbia, Missouri in 2005 was one of 4 cities to receive $22 million in grant funding from the federal government. It was transportation funding, and the goal was to create more walkers and bikers in their community, but they could spend the money however they wanted, and every city did something different. Columbia was unique because they spent almost 20% of their budget not on building bike lanes or bike infrastructure or sidewalks. They were just they did a mass marketing campaign to change the culture around how people perceived walking and biking in Columbia. And so that's what's on here. This is from their report. They did an awareness campaign, invested in professional branding and marketing, and much like Project Verb, awareness of the program was really high, 83%, and it worked. The percent of residents who thought that Columbia was a bike-friendly or pedestrian-friendly community went from 66% to 80% just over a 3-year period while this campaign was going on. And when people felt that their community was safe to be active in, they are more active. So biking increased by 26%, and so did walking. So those are 2 campaigns. I actually lived in Columbia, Missouri at the time, and I still have this commercial ingrained in my head because I heard it so much. The last thing I'm going to talk about as a mass media campaign is more local, and it has to do with more social media. Twitter is one, and bike and pedestrian Twitter in Kansas City is one of the strongest communities, social media committees or communities I'm aware of. And it can be used to mobilize people incredibly effectively. So for example, 2 years ago, North Kansas City had done big streetscapes improvements to Armour Road. If you've ever been up in North Kansas City, here's a picture of what it looks like after the transportation. There's protected bike lanes, there's beautiful painted crosswalks. However, because things are new, which has a lot to do with it, and different, a lot of people didn't like it and were very vocal about that. And so immediately after it being completed, there was complaints to the city, and they held a city council meeting where they discussed actually ripping out all of these newly done improvements to the infrastructure. And Twitter really mobilized behind it. Here's one tweet from Bike Walk KC, advocacy alert. 2 actions to take for a safer Armour Road in North KC. Attend the city council meeting at this date and time and tell the city why you and your family need complete streets. And you know what? It worked. Grassroots organizers successfully, including traditional door-to-door and online outreach, were quickly able to get 672 petitions submitted to the city. They were able to make a presence at the city council meeting, and the city council unanimously voted to keep these changes. So these are just 3 examples of how media, mass media, can play a positive, really transformational role in making communities more walkable, bikeable, and healthier. And that's really what we're all about with this meeting and these series of meetings, is to figure out how to engage in mass media to help Kansas City be an active place to live. And we base a lot of our work off of a national physical activity plan. And the National Physical Activity Plan, I'll talk about it a little bit more in just a second. It's organized by societal sector. There's 9 of them. One of those is mass media. And this is just a screenshot of the National Physical Activity Campaign, National Physical Activity Plan, mass media overview page. And there's a lot here. I'm not going to read all of it, but it's just going to, I'll read a couple sentences to really summarize what we're here for. So mass media campaigns are designed to increase awareness and or knowledge, influence attitudes and beliefs, and eventually result in behavior change. All the things that you guys entered in that Mentimeter at the start of today's presentation. They've been effectively used to influence health behaviors at community, state, and local levels. They can be deployed as standalone interventions or as part of a broader intervention or program. And so we're going to, over the next few months, we're going to sort through what we think are effective strategies and tactics to involve mass media in the work that's being done in the Kansas City region. The Kansas City Physical Activity Plan, and you can find out all this information on our website, kcphysicalactivityplan.org. And Bryce, maybe Bryce, you can throw some of these in the chat as we go through them. We launched 2 years ago in October. We are taking a multi-year approach to developing the plan. The end of the first year was December 2020, where we focused on establishing our first 6 sectors. Over that first year, we completed 55 total meetings with community partners and other members of the community. We held a physical activity summit in September 2020. In total, we engaged 550 individuals, and we had a whole bunch of different surveys that we submitted throughout a variety of different formats. At the end, we created 2 documents, a Kansas City Physical Activity Plan playbook and the actual physical activity plan. And I'm going to show you each of those in just a couple slides. We immediately saw the fruits of our labor. In November 2020, Wyandotte County, the unified government of Wyandotte County, was considering a complete streets ordinance. We were able to successfully advocate along with a whole bunch of other people, and complete streets were unanimously adopted. And I'd like to think that's in part because we could say we have all of this community support behind these initiatives and these strategies, one of which was specifically adoption of complete streets. We've received several grants to begin implementation. So we start out with planning and then we move to implementation. So we are actively implementing projects right now to support the original 6 sectors. We are currently in year 2. And so that involves the addition of 2 more societal sectors, mass media and sports. And so once we can complete the planning for those 2 sectors, we are going to release the 2nd edition of the Kansas City Physical Activity Plan. And so that will happen, we anticipate, in early 2022. So here are the goals of the overall Kansas City Physical Activity Plan. And that is to create Kansas City focused, sector-specific strategies and tactics that, if accomplished and implemented, will foster a culture of physically active lifestyles in our region. By doing this, we are making a collective statement. All of us are making a statement. Everyone that's involved in the plan makes the statement that physical activity is a public health priority in Kansas City. We are also creating a multi-sector coalition to advocate for priorities. So it's not just Children's Mercy, it's not just Bike Walk KC, it is all of us. And we are creating a framework for implementation of the strategies and tactics. So anyone who looks at our plan and the strategies and tactics can start implementing them. They don't have to be involved with us. They don't have to be involved in any of the planning. They can just take it and run with it. Additionally, we have 3 overarching priorities. The first is we are advocating for increased local funding for physical activity initiatives. We are creating regular, comprehensive surveillance of physical activity metrics. And we are doing regular reporting on those metrics through the form of a report card. And I'll talk about that a little bit more in a few slides. We have 4 guiding principles, and these principles are things that we consider throughout everything that we do. The first is we believe that everything should result in equitable access to safe places for physical activity. We only support evidence-based approaches that are community informed, and they address systems-wide policy and environmental change. So we certainly are supportive of things like one-off events, whether that's a health fair or a physical activity summit, but our primary focus is on addressing the system, policy, and environment that we operate within our region. So here are the 10 societal sectors for the Kansas City Physical Activity Plan. And so these, if you think about how you live your life, hopefully every minute is touched by one of these sectors. So, for example, early childhood. I had my baby with me earlier. Normally our baby is in childcare, so our child is exposed to the early childhood setting. Soon she will go off into school. We use infrastructure every day, whether it's getting to work or daycare or school or to get to the grocery store. So that's represented by infrastructure. Of course, we spend a lot of our time making sure that we're healthy, so healthcare is represented. Of course, we spend a lot of our personal time participating in things like sports, parks and recreation, faith-based activities. So each one of those are representative as well. And all of those are active sectors right now with the Kansas City Physical Activity Plan. We are launching 2 more sectors next year. Those say 2021, they have been moved to 2022, and that's business and public health. Of course, we spend a lot of time working. Most of you are working right now, I assume. So your business is, you spend a lot of time at work. And of course, the pandemic has showed us how important public health is to everything that we're doing. And so these are the societal sectors for which we are currently developing or have developed strategies and tactics as part of the physical activity plan. The individuals that you see listed are those who are serving as content experts and leaders of each one of those sectors. So you see lots of different groups listed here. So of course, some of the usual suspects that you might expect: Bike Walk KC, Kansas City, Missouri Parks and Recreations, but we also have others that you might not expect, such as Harvesters, UMKC Health Equity Institute, Calvary Community Outreach. Of course, we've got bank and newspaper. So we've got a broad coalition that are doing this work. So here, just a little bit about the organizational structure, weighing in a program at Children's Mercy. We are the backbone organization. So that is myself, Bryce Miller, who's also, you met earlier, and Shelly Summer, who I believe she's also on today's meeting. We are also about ready to hire 2 new research assistants. So if you're interested in coming and working us in a professional capacity, reach out to us. We'd love to have you join our team. And we provide administrative support for the project. Our core work group, consists of all of the sector leads. You saw them on the previous slide. Listing out all the sectors and some other what we call ad hoc members. So for example, we've got representatives from the Health Resources and Services Administration, Office of the Assistant Secretary for Health, and we also have some people from the city of Kansas City on our core work group as well. And they provide strategic decision-making, leading sector work groups, and recruiting other members for participation. So we've really kind of created 3 public-facing documents over the past year that demonstrate our work. And Bryce can throw these into the chat as we talk about them. The first is related to one of those overarching priorities that I mentioned, which is regular reporting of physical activity metrics. And so that we released last year in the form of the 2020 Kansas City Regional Report Card on Physical Activity for Children and Youth. And so that is basically a report card for how we're doing based on regional surveillance data. I don't have a lot of time today to talk about that, but feel free to check out that report. It's very, very informative. Our other 2 documents are related to the actual plan itself. So I'll first talk about the actual Kansas City Physical Activity Plan. That's on the right-hand side of your screen. So this was released in March of this year, and it's a very detailed document describing our strategies and priorities for each sector, and lots of information on the process for how all of those strategies and priorities were developed. It's quite long. It's like 85 pages, I believe. So there's a lot of information there. And for some people, that's very helpful, but we also know some people just want a very straightforward, easy to read document. So we also have a playbook, and that's what's in the middle here. And that's an easy to read document that really just has our strategies and priorities. And we have this card style format that I'll show you in just a minute. All of these things you can find on our website. So I've said strategies and tactics several times, and here's what I mean by a strategy and a tactic. So a strategy in this context is a broad, evidence-formed approach to promoting physical activity. So each sector has somewhere between 3 and 5 strategies that have been developed. And they're broad, they're kind of general in nature. Then within each strategy, we have a priority tactic. And so those are tactics that are actionable, and if accomplished, would support the sector-specific strategies. So they're much more specific than the strategy. And I've got some examples of those that I'll show in just a couple slides. So here are the 22 strategies that were developed in year 1 of the Kansas City Physical Activity Plan for the first 6 sectors. And these are the cards that I mentioned earlier. So these are designed to be easy to read and straightforward. So if you go on our website, we have a list of all of these cards, and you can click on them and find out more information like the tactics and objectives, things like that. Each color represents a different sector. So orange is healthy schools, yellow is early childhood, so on and so forth. And so as you can see, each sector kind of has their own little approach, and there are anywhere between 3 and 5 strategies for each sector. And I'll show a couple sectors and more a little bit closer so you can see what that means. In addition, in that long plan, we follow it up with approaches, recommendations for local leaders, whether that's things they could do or things that are already happening. And if you're just a community member, if you're a parent or a bicyclist or something like that, we also give approaches for you that you can use if you're not an organization. And so here's what the plan looks like. Here's an example from the healthy schools sector. There's 3 pages that talk about the strategies in an overview, the process, on how they develop them. In this case, there was surveys, youth surveys, and pen and paper surveys. And then once you get to the actual strategies, there are the strategies, the specific priorities for each strategies, and then here's those approaches, local leaders, and community involvement information, all for each strategy, for each sector. So there's a lot of information. So with that as an overview, I think now I haven't been looking at the chat. So let me just see if there's any specific questions before we go on. Looks like not, just some comments. So now I think is where we want to start engaging with each of you. And before we do that, what we've done for most of our sectors in the past is to start with the National Physical Activity Plan. So we base all of our work off of the National Physical Activity Plan. This was started a little over 10 years ago, and they did the heavy lifting in terms of organizing the sectors and developing some starting strategies and tactics. Now, the plan was intended to be adopted on the local level, and so they acknowledged that a lot of the strategies that were developed on the national level don't make sense on the local, statewide, or regional level. But with that in your mind, here are the 4 strategies that were developed for the mass media sector as part of the National Physical Activity Plan. So strategy 1 is government health agencies like the CDC, for example, in partnership with national nonprofit health organizations, should launch a national physical activity campaign to educate individuals about effective behavioral strategies for increasing physical activity. Strategy 2 was physical activity professionals, people like me, should partner with communications experts to develop mass communication messages and a standardized brand for promoting physical activity that is current with federal physical activity guidelines. Strategy 3 is professionals in physical activity and public health should inform mass media professionals about the effects of physical activity on health and effective strategies for increasing physical activity at the individual and community level. And strategy 4 is professionals in physical activity and public health should optimize application of social media and emerging technologies in media campaigns to promote physical activity. So those are the national strategies. And so now we want to know what you think. And so I'm going to hand it off to Bryce, and he's going to pull up the Mentimeter again. And we want to get your feedback.
All right, so if you guys want to go back into that Mentimeter that we used at the beginning, you can go to menti.com and then we'll enter this code in there. It might be still available in your browser. If you go back into whatever browser you're using on your phone, And you can go to the next slide. And this is going to allow us to rank the sector strategies that Robin just reviewed with us. So basically what we're going to do is you'll be able to click on that drop-down list. You'll be able to see each of the 4 strategies. The first one that you select, that's going to be your top ranked strategy. And then it'll go on and so forth. You can do 1, 2, 3, and then 4.
Bryce,
We'll give everybody a few minutes here and then we can see what the results are.
Hey, Bryce, can you hear me?
Yes, I can.
I'm sorry to interrupt, but looks like somebody else is like me, doesn't have the code. Could you just repeat the code?
Oh, absolutely. Yeah. So the code is 1190-5988.
And Bryce, can you put up your slide again, your screen again?
Sure.
So we can see that. And these results are updated in real time. So you're going to see, as you can see, a couple people have already ranked. So you can see which those 2 people have ranked already, but this will update in real time.
Okay.
And I will say it looked like one of those didn't get updated, but number 1, launch a national physical activity campaign. We obviously aren't going to launch a national physical activity campaign. So that should read a regional physical activity campaign. So in case that influences your decision making. And this is, we're starting out very with a very crude ranking system. We understand you might have questions or comments or caveats to your rankings. That's okay. We've got some more detailed questions that are going to follow up after this one. This is simply a starting point. Yeah, and just to repeat, in case some people are hopping on late, to do the Mentimeter, just go on your phone or on your computer to menti.com, MENTI.com, and enter in the code 1190-5988.
All right. So it looks like we got 11 people that have voted. I think that's just about everybody on the call. So we can proceed and we'll get more into the weeds on each of these strategies. And
actually, just give them another, why don't you give them another minute, Bryce?
Sounds
I think
good.
There might be a couple more still wrapping up. Maybe we'll give you another 15 seconds to enter in your rankings. Okay, so this is very helpful, right? So things are pretty close just from using Mentimeter in the past. There's probably just a couple votes separating most of these, 1 from 2, 2 from 3, 3 to 4, but we do see some clear separation. Looks like, strategy number 2, partnering with communications experts to develop a communication message and a standard brand is our top choice, but close behind is a regional physical activity campaign to educate individuals about effective ways to become more physically active. So that's, you know, like a Kansas City focused Project Verb or something like that. Third and fourth are optimizing social medias. And the fourth one is people like myself, professionals in physical activity, informing people in mass media about how helpful or how physical activity can improve health. So that's great. Now, yeah, Bryce, take it away, and let's move on to the next process here.
Awesome. So just to get some further data on each of these strategies, as you can see, we had a few rise to the top. The top three were relatively close, but this will allow you guys to kind of rank them and really pick away at how we would be able to proceed with these strategies into the future. So what we'll have you do next is rank them on a Likert scale based on the question. And we'll also give you access to the associated tactics, so you can get a better view of what this strategy would do for Kansas City. So you can go back to that Mentimeter. And for the first one, this is going to be strategy 1. And you can review it right here. These are the associated tactics. Identify and test evidence-based media messages and campaign strategies with the greatest reach and likelihood of influencing population physical activity levels. And then the second tactic for strategy 1 is advocating for federal funding to support a regional physical activity campaign. So we're not necessarily voting on these tactics. We'll do that later in the coming months. But these are just used to better describe what this strategy means. So here are some of the questions that we're going to answer for each of the strategies. How likely is this first strategy to be implemented locally? And if you forget what the strategy is, I'm going to stay hovered over this on this screen. And you can also just click on that on your phone screen as well, and you should be able to see it. The second one is, do you think this can be implemented locally in the next 3 years? And then the third is 5 to 10 years. And the final question is, how likely is this strategy in general to improve physical activity and health in Kansas City?
Yeah, so the purpose behind these are there are some great strategies that have been developed, but a lot of them don't make sense locally, or if they do make sense, there are things that will take some significant amounts of resources or a significant amount of time for them to be accomplished, and maybe they would have minimal impact on health. So that's what we're trying to sort out here. And just in terms of a big picture, we are going to use this information that we collect today for discussion points in our upcoming meetings. And so at the moment, we're just doing rankings, but then in future meetings, we're going to really dig into these and talk about why they might not be able to be implemented locally, or why it's going to have a big impact on health. While you guys are filling that out, Bill Brandmeier had a great point about just the 4 strategies in general and how they're all important. And he's exactly right. And so each sector has kind of handled this strategy developed differently. Some have used this process to figure out which 3 or 4 they wanted to focus on, and they only ended up using 3 or 4 in the actual plan. However, others have ended up using all the strategies that were submitted by or developed by the National Physical Activity Plan, and they just said, we like all of them, we just think maybe 1 and 2 are the ones that we should really focus on. So,
yeah. All right, sweet. So it looks like we got 13 responses. Great. That's really good data for us. This will, like Robin said, be able to guide our conversation next month. So we're going to move on to the next strategy. Strategy number 2. So there's 3 tactics for this instead of the 2 with strategy 1. Some of those tactics are engaging public health agencies and stakeholders at all levels across sectors to develop a standardized brand for promoting physical activity. And then conducting market research to identify effective mass communication messages and standardizing the brand for also promoting physical activity. The third tactic is developing and disseminating a toolkit to support the application of messages and the standard brand to promote physical activity at the state and local levels. So let's vote on this now. How likely is this to be implemented locally? 3 years, 5 to 10 years, and how likely is it to improve physical activity and health?
Yeah, so this strategy was the one that in our initial ranking ranked the highest. So this will kind of help us tease out why it may have been rated so high.
All right, awesome. Yeah, that basically falls in line with where you guys, ranked the top 2 strategies. Those are both consistent with one another. Let's go on to strategy number 3. All right, so for this one, this is professionals in the physical activity space and public health space, informing mass media professionals like yourselves of the effects of physical activity on health and effective strategies for improving physical activity at individual and community levels. So there's 3 tactics, educating media professionals about the documented effects of physical activity and its effect on obesity and non-communicable diseases, reframing media professionals' understanding of the impact of physical activity on public health and the effects of other behaviors. And then the third one is designing materials for informing mass media professionals regarding strategies for improving physical activity at both levels. So I think this one was our lowest ranked. And with these initial votes, I think this survey was open prior to this meeting. So we do have, 3 or 4 people that completed some of these votes beforehand. And just to let you guys know, we will keep this survey open after the meeting. So if there's anybody that wasn't able to be on this call, we're still going to allow them to vote so that we get a pretty comprehensive view of where we're sitting and where we think these strategies should rank to one another. All right, looks like everybody voted. So it looks like for this one, kind of middle of the road for implementation locally, but it's pretty likely that it could be implemented locally, but its effect on physical activity and health is relatively low based on our responses. All right, on to strategy 4. So this strategy is focused on professionals in physical activity and optimizing the application of social media and other emerging technologies and media campaigns to promote physical activity. So there's 2 associated tactics. One is supporting public health agencies and stakeholders at all levels to incorporate these social media techniques in physical activity promotion programs. The second tactic is supporting public health agencies and stakeholders to apply emerging technologies in these promotion programs.
Yeah, and
it looks like those are the exact same. So let's see, apply emerging.
No, the second one is using like biometry is like syncing your Fitbit to your social media account to engage in like a physical activity challenge or something.
Yeah, that makes sense. Sweet. All right, let's vote on this. All right, wait for one more vote. Looks like we think optimization of these technologies would is very likely to improve physical activity and health. So that's really useful for when we talk through these more in depth on our next meeting. Awesome. Thank you guys for voting on all of these. This is really helpful. And we'll share all these results with you from this meeting in our kind of newsletter recap from this meeting. So if you want to share it with anybody else, feel free. And like I said, this will be open. I think I'll keep it open for like the next 2 weeks or so. So if there's anybody else that you feel should have a place in this conversation and should vote, feel free to share the link with them.
Great. Thank you, Bryce, and thanks all for submitting those responses. So, as Bryce mentioned, this is kind of a starting point to get us just thinking about what strategies and tactics might be for the mass media sector. And we're really going to dive into strategies and tactics in a lot more depth in the upcoming meetings. And so the general timeline that we've outlined are monthly meetings that are about an hour and a half in duration. The October meeting, we've got set aside for sector prioritization and discussion. And so this is where we're going to talk about those strategy, that should read strategy, prioritization, and discussion. So we're going to dive a little bit more into those strategies, what the feasibility, implementation prospects are for each of those, whether they're already happening or what things are already happening in our region, and how we need to adapt things specific to the needs of Kansas City. That probably will take one meeting. Oftentimes, it often bleeds over into the second meeting. But for right now, we've got it kept into the October meeting, whereas in November, we will discuss the specific tactics, so the more actionable items related to each strategy. That's what we'll work on in November. And then December, assuming we continue on this trajectory, we will finalize the strategies and tactics and validate the plan for release later in early 2022. Sometimes we have to add an additional meeting just because we're having such great discussion in the strategy and tactic prioritization process. But right now, we've got it set aside for these next 3 meetings finishing by the end of the year. Just a couple more points, and then we're going to let you go for today. And that is, we've got a really good group assembled here, but we know for a fact that there's other people that we may be missing. And so we would like your input on who you think should be invited for these discussions so we can hear their voices. And Bryce is going to paste, or maybe he's already pasted, a survey where you can suggest new members. Yep, he's already added it to the chat box. Of course, if you just want to email us, feel free to do that. and we can manually invite them as well. Other logistical things, I guess, related to invitations, we're managing this using Evite. So you should have got an Evite to get on this meeting. We'll send out the next Evite for the October meeting in the next couple weeks. You can RSVP there. You can find the Zoom link there. Additionally, I want to make one note is that Evite has a bug that we're currently trying to resolve. If you click on the add this meeting to my Outlook calendar, it automatically adds things to the Eastern time zone, so 1 hour ahead. So you have to manually make sure that it reflects the meeting time that's listed in the actual Evite. This is only a problem we've observed with Outlook. If you use Gmail or Yahoo Mail, we don't believe it's a problem. So just double check if you're downloading into Outlook that you've got the correct time for the Evite. Again, sorry about that. We're trying to get it resolved, but you know, we're at the mercy of Salesforce, which owns Evite. The only other logistical piece is finding a time to meet for the next October meeting. If we follow the same approach that we did for this one, we are choosing the last Tuesday of the month and 12:30 to 2 p.m. If we think that that's a good time, but if you think that there's something that is going to negatively impact participation by a bunch of people, please let us know. For example, there's a monthly call that LinkedIn hosts at the last Tuesday from 1 to 2, and you know, a whole bunch of people can't make it. Please let us know and we can try to find a better time. But right now, we've got scheduled our next meeting for Tuesday, October 26th, 12:30 to 2 p.m. So I'm seeing head nods, so hopefully that works for everybody. Additionally, I guess the last logistical piece I'll have, Bryce mentioned this earlier. In the next week, we are going to send out all the meeting minutes, and we do it in the form of a newsletter. So in that newsletter, it'll have a recording of this conversation. It will also have a summary of some of the things that we've talked about. For example, all the results from those Mentimeter polls and links to the October Evite. So look for that in your inbox in the next week. With that, I'm going to hand it over to Toriano and Melinda and ask if you guys have anything you want to add.
This has been a great present. Oh, I'm sorry, Melinda. Go ahead, Melinda. I'm sorry.
Go ahead. Go ahead.
You got it. You have it. No, you have it. Go ahead.
Oh, yeah, I'm just going to say we really appreciate everyone's time again, and thank you so much. And just wanted to let you know that, you know, we've, Toriano and I've sat on some of the core work group meetings, and there's a lot of passion from those other groups, so that they're already doing some great work. And I think this group is definitely going to be able to help them promote some of the things that they already have in process. So just know that you're in a good group of people that are just really passionate about this project. And I'm just excited that you were all able to join us today.
Exactly. Same deal here. I know you guys took time out your busy day to join us. As co-leader of this sector, I'm looking forward to working with you guys and picking your brains and your mind about how we can promote physical activity in the metro area. You guys are some of the best at what you do. That's why we targeted you and reached out to you. So hopefully you guys will come on board and join us and help spread the word, because as you know, I didn't make this up. Children are our future. We got to help them lead the way, right? So let's do it. Let's do it.
Great. Thanks, Toriano and Melinda. I guess, we've got just a couple minutes. So if there's any questions or comments by the group, feel free to bring them up now. Or if you have any announcements that you would like to make for the group that other people here might be interested in, feel free to do that now.
I had a quick question, if it's okay.
Yeah, please.
And I apologize if in the communications about this meeting, I didn't catch it, but I'm curious if you all could clarify what the collective team here on the phone is moving forward. Are we like just an advisory council that'll touch base every month or so? Or do you want us to get involved actively in helping form strategies and tactics? And the last piece might be, do you want our help in development and execution of a campaign, mass media and otherwise?
I'm so glad you asked that. And please, of course, everybody else ask questions because other people are thinking the same things as well. So yeah, so how this process is going to play out, we kind of have it in phases, or we've done the other sectors in phases. The first phase is strategy and tactic development. And so that's what we're going to work on the next 4 months. And all of that will happen in these meetings. And so all of you that are on this meeting will have a chance to contribute, to offer suggestions and guide the discussions for what the strategies and tactics should be. And then at the end of the process, we will have, just like the other sectors that have already finished their work we'll have 3 to 5 strategies and 2 to 3 or 4 tactics for each strategy for the mass media sector. And then that's kind of the end of the planning process. And if you want to end your involvement at that point, that's great. We appreciate all of your input. However, then we will move into the implementation side, the implementation of the strategies and tactics. And that could look a whole bunch of different ways. And each sector really decides how that looks. So some sectors have decided they want to keep meeting in this format on a monthly basis, and they want to try to get some grant funding to fund implementation projects. Some other sectors have, they said, we want to meet every 3 months, but we're going to divide up into specific actionable committees that are working on strategy 1. This committee's working on strategy 2. This committee's working on strategy 3. And every 3 months they come together and say, here's what we've accomplished in the last 3 months. And then others have taken different approaches where they say, well, I'm just going to take this work back to my organization, and we're just going to try to accomplish some of these things ourselves. So really, it looks it really depends on what the sector decides it should look like.
Okay.
Hopefully that answers that question.
I think that does.
Great.
I have a more granular question, but don't want to dominate the question, so I'll defer to everybody else for a second. Just a specific question, as I listened to the presentation, which was excellent, by the way, very comprehensive. I got excited about doing 2 things potentially that we have done, and I'm sure many of our colleagues on the call here have done, for development of any kind of marketing communications campaign. One is creating personas of the end user segment. So it could be kids and teens, early adults, and work together to create kind of a 360 degree picture of those people psychographically and demographically. So we actually tangibilize who these segments are. And that's just important in terms of crafting the campaign, right? Who we're going to talk to. And then the second piece is we call it customer journey mapping, to understand everybody within each of those personas goes through a process of awareness, interest, desire, action, and that can drive messaging and media tactics. And I'd love to, on a volunteer basis, I assume this is all about, contribute at the right time for those 2 pieces, because I do think they could be very helpful and meaningful.
That's great. And I'll kind of maybe let Melinda and Toriano answer. I think somewhat of the answer is yes, that's exactly the type of information we need to know as we develop this strategy, is what are going to be the most effective techniques to do that.
Great.
Yeah, definitely. I mean, yeah, creating journeys is definitely something that we probably need to start on kind of in our first meeting. And yeah, thanks for bringing that up. That's great input.
Yeah, and again, me and Melinda, we're just the co-leads here. This is a co-op. We're gonna work together with you guys, and any ideas you have that you think can work, we're gonna consider, and that's a great start. So we thank you for that.
Awesome.
I guess I'm just joining here, so there's a lot of questions I have, but I look forward to reviewing the recording. So I was just going to ask, is there a list anywhere of all of the different participants in this sector? I just think maybe it could help, especially if there are several companies that maybe we all network together professionally. That could be an interesting angle to think about.
Yeah, that's a great question. And Bryce, do you mind putting that contact list in the chat? Now, I will just say the list that we have is just a list that we used as brainstorming and to create the initial invitation list. And so not everyone, of course, is participating. They were just people that we had on the list. So Bryce can share that. It's a Google Doc. So you can feel free to review that, and you either can just add people to that list, or you can use the RegCap link that Bryce pasted in the chat about 10 minutes ago, and we can add them to the list.
Great, thank you.
I'm relatively new to this call, but I had some questions as well. Is there any research or insights from kids that we could review? It'd be really helpful to just know what they're really interested in, and what their daily life is with regard to balancing school and home life.
It's a great question. I don't think we have any of that information. And so if that's something that is critical, maybe that's a new strategy that we need to, or tactic that we need to create, is we need to collect this information to inform what the actual mass media campaign or a communication strategy is. I don't believe we know that information.
I'll jump in for just.
Yeah, go ahead, Shelley.
Sorry, Robin, I didn't mean to cut you off there. I agree. That's an excellent question. In terms of crafting a message, I haven't seen anything new come about in terms of what kids are interested in or what they're interested in hearing. But about a little over 10 years ago, there was a national campaign called the Verb campaign. So if you want to look at campaigns around physical activity targeted at kids, that's one that I believe was led by the CDC, if I'm not mistaken. And it was essentially, what's your verb? And the verb is supposed to be the physical activity that you want to engage in. So it's trying to get kids involved in doing anything. That is, dated. I'm sure if they repeated the process of developing a message campaign, it might look different for kids today. But at least it's something to get a picture on what's worked for kids in the past. And again, that's really related to a campaign, not necessarily where kids are receiving information or how different their worlds look today, especially as compared to 1 year ago.
Yeah, and that was, if you missed it if you came on a little late, I had a Verb video, a Verb commercial at the start. And
Yep.
So that'll, I'll include all that information in our newsletter, some of their sample. It is dated, it's from 2002. Yeah, I think that the idea is right on, Shelley.
Thanks for that link, Jacob.
our sectors, because we have the healthy schools sector, and those people are actually involved in the school districts. And we can probably work with them to come up with a way to do some surveys and find out, what kids are interested in.
Yeah, that's a great point, and I didn't really mention that in our overview. But one of the key benefits of the Kansas City Physical Activity Plan, as opposed to other kind of alignment work around healthy lifestyles or physical activity in our region, is we specifically are multi-sector, and that lends itself to cross-sector collaboration. Exactly what Melinda said. We have monthly core work group meetings where all of the different sectors get together, and we can say, hey, schools, we were just asking about what types of physical activity programming or communication strategies are most effective in 5 to 10-year-olds, 10 to 15-year-olds, and 15 to 18-year-olds or whatever. Can you help us? What information exists? And we can all work together on this. And there are all of our implementation projects that are currently ongoing are multi-sector in exactly those ways. And I think mass media probably is the one that is going, all the other sectors are going to be begging for cross-sector collaboration with this group. Great question. We'll try to find a little bit more in advance of the October meeting for sure. Any other questions? Thanks for pasting that research article about verb in there.
You bet.
Okay. Well, thank you all. Thank you all for taking time out of your busy schedule today. We all really appreciate it. Look for our newsletter to come out next week and the Evite for the next meeting shortly thereafter. Thanks everybody, and have a great rest of your week.
Thank you.
Bye,
Thank
all.
you.
You guys, thanks.
Thanks all. Cheers.